Hey, future doctors, welcome to Dentistionary. Here, you will be provided with information for the doctors from the doctors. Today, we'll be completing our next part of the oral mucous membrane. So let's start with the keratinocytes. Almost all cells of both keratinized and non-keratinized epithelium contain cytokeratin proteins. Okay, so it's a very important protein, cytokeratin protein. These cells are collectively referred to as keratinocytes. The cell which contains cytokeratin are called keratinocytes. These are epidermal or epithelial cells that synthesize keratin. Okay, so keratinocytes synthesize creatine. Okay, they show cell division, undergo maturation, and finally desquamate. They increase in volume in neat successive layer from basal to superficial. The cells of each successive layer cover a large area that do the cells of the layers immediately below. So, in the previous video, we were talking about the granules in the orthokeratinized epithelium. So the granules which are present in the orthokeratinized epithelium are these keratinocytes. These are present in more numbers in the keratinized squamous cell epithelium or the keratinized stratified squamous epithelium. Okay. Non-keratinocytes, these are few cells in oral epithelium do not contain cytokeratin. These are called non-keratinocytes. They do not have the ability to keratinize. Okay. Unlike keratinocytes, they do not show mitotic activity, undergo maturation, or desquamate. So they remain as they are, the non-keratinocytes. They are not arranged in layers and do not form desmosomal attachments with adjacent keratinocytes. Okay, so they does not contribute for the communication. They are usually dendritic and appear unstained or clear in the routine H&E stains. These are identified by special stains or by immunocytochemical methods. These cells migrate to oral epithelium from neural crest or from bone marrow. So these are protective type of cells. You can see the non-keratinocytes, and these does not contains any H&E stain. So here around them there is no such coloration. Okay. Non-keratinocytes includes melanocyte cells, Merkel cells, Langerhans cells, and inflammatory cells. So These cells have different function and they have different places to belong with. Melanocytes, the basal layer, melanin synthesis, as the name suggests, melan. Langerhans cells, these are present in upper layers involved in immune response, so they are protective cells. Merkel cells also present in basal cells, specialized neural receptor sensitive cells. So these detect the sensitivity and the infiltration of foreign particles or foreign toxins and call the Langerhans cells to attack them. Inflammatory cells like lymphocytes and neutrophils, these WBC type cells, transits and passes through the epithelium to surface. So these move from the epithelium or the uppermost layer to the basement membrane or the lowermost layer. These have defense mechanism. Langerhans cells are found in the stratum spinosum and occasionally in stratum basale. These cells have long, thin extensions of cytoplasmic membrane called dendrites. They can be distinguished from keratinocytes by the absence of desmosomes and tonofilaments. Can be distinguished from the melanocytes by the absence of premelanosomes. So they have premelanosomes, but these does not have premelanosomes. Contains rod-shaped or racket-shaped Birbeck's granules. Remember this word, which allows for identification of the ultrastructural level and antigen-presenting cell. So it presents the antigen. Whom does it present to? It presents to the inflammatory cells. Okay, the WBC part. Okay. They engulf antigens from the external environment and the intracellular lysosome split the antigens into peptide components. So it carries the foreign particles to the lysosomes and lysosome digest it. These fragments are then transferred to T lymphocytes for the further degradation. Merkel cells situated in basal layer of the gingival epithelium, mean to notice, possess desmosomes, tonofilaments, occasionally are usually associated with the axon terminal. The Merkel cell are associated axon terminal form a complex that serve as a touch receptor. So Merkel cell with the axon terminal forms a complex that serves as a touch receptor and are usually found in groups of clusters. Melanocytes, melanin producing cells, basal layer में पाए जाते हैं. Gingival layer, epithelium mainly in the attached gingiva. Okay, attached gingiva. These cells arise from the neural crest, lack of tonofibrils, desmosomes and hemidesmosomes. They're highly dendritic in nature. The most characteristic feature of the melanocyte is the melanosome granules, which can't be found in the Langerhans cells that differentiated found within the cytoplasm. A more heavily pigmented gingiva is due to the production of melanin and its subsequent uptake by the epithelial cells. There is a great variability in the location and distribution of melanin in the oral cavity. Okay, these are the melanocytes present with dendritic progress. As you can see, these are the dendritic projections of the cytoplasm. Okay. Melanocytes in the basal layer, these red type of cells. This is melanin pigment noticed in the lamina propria. Okay. So Indians have brownish or darkish gingiva or the gums because of these melanocytes present in the attached gingiva or the marginal gingiva. That's why the attached gingiva appear more darker than the marginal gingiva. The marginal gingiva is this, which surrounds your tooth. And the attached gingiva is below the sulcus or the line that separates the marginal and the attached gingiva. These attached gingiva have the melanocytes. Okay. Area with keratinized mucosa. These are gingiva, hard palate, specialized mucosa or the dorsum of tongue, and the vermilion zone. Vermilion zone is the lip and oral mucous membrane junction. Okay. When you palpate the lip or move it upward, the lip will be showing a part of separation, this part of separation. And this is the lower lip here, just a rough sketch. This junction is called the vermilion zone. Then the non-keratinized mucosa, it is found in the labial and buccal mucosa, the cheek lining and the lip lining, soft palate around the uvula, you can say, alveolar mucosa and vestibular fornix around the alveolar processes, mucosa ventral aspect of the tongue. Remember the dorsum and the ventral, mucosa of the floor of the mouth because there it has salivary openings. Now the papilla of the tongue, the dorsal surface of the tongue has numerous tiny projections called papillae, which gives it a rough texture. If you will see a cow's tongue or a tiger's tongue, in the tiger's tongue, the papillas are more prominent to see. You can Google it. Papilla can be easily observed by the naked eye, especially when the tongue is dry. Three major types: filiform, fungiform, and the circumvallate. Filiform means thread-like. These are pointed, conical structures in the anterior two-thirds of the tongue and are arranged in numerous rows parallel to the sulcus terminalis. Okay. The sulcus terminalis is the termination of the sulcus. Okay. These are the most numerous among all the papilla, so these are more in number. Histologically, these are made up of stratified squamous epithelium, keratinized. We have just studied it, containing a connective tissue core. The lip of the papilla, tip of the papilla usually shows more keratin. Okay, the tip of the papilla. These papillae do not contain taste buds. See, this is the structure of the filiform, the keratin on the upper layer, on the upper part, and this is the skeletal muscle of the tongue. This is a schematic diagram, Lamina propria, skeletal muscles of the tongue. This is your keratinized part, keratinized stratified squamous epithelium, and keratinocytes are present here. Fungiform means mushroom-like, distributed between filiform papillae and are seen mostly near the tip of and the side of the tongue. So it contains some taste buds and it helps the filiform to create taste. These are covered by thin stratified squamous epithelium that appears non-keratinized. So it is non-keratinized, especially on its surface. As a result, the vascularity of the connective tissue shows through and the papilla appears reddish in color. Few taste buds are seen on the dorsal surface. Okay. Fungiform papilla are here, mushroom-like you can see, and this is the taste bud present in that, and this is the non-keratinized squamous epithelium. Now comes the circumvallate, means surrounded by a wall ridge or the depression, also called vallate papilla. These are characters seen in front of the les terminalis on either side of the midline. Okay, these are about 8 to 10 in number. For the terminalis part, you can Google it. You will be seeing a very prominent part, okay, very distinctive part of the tongue. Each papilla is surrounded by a circular depression or furrow in mucous membrane. The epithelium is of stratified squamous type, which is keratinized. Lateral surface of the papilla are non-keratinized. So, dorsal surface is keratinized and lateral surface are non-keratinized and contains numerous taste buds. The salivary glands or the saliva helps in the distribution of the taste or the sensors, and the receptors present in the taste buds catches it and creates the taste of a food. The connective tissue core shows many secondary papilla, especially towards the dorsal surface. For minor serous salivary glands are noticed in the submucosa beneath these papillas. So this helps in secretion of the salivary glands from the serous type, minor serous. These glands are the only minor salivary glands that are serous in nature, and they open their secretions into the Toe of the circumvallate papilla. These are von Abreu glands, and we have studied in the salivary gland video. This is the crypt around the circumvallate papilla or the valley-like structure, and these are striped by them. These are taste buds, numerous taste buds present, and beneath them, the serous salivary glands are present, the von Abreu glands. Here it is non-stratified, non-keratinized, and keratinized. Okay. Now the age changes. We have the termination. The oral mucosa of an elderly patient has a smoother and drier surface than younger patients due to dry therapy or any systemic disease. Or we can say as the age progresses, we have studied in the salivary glands that saliva thickens and the production is less, so our mouth becomes dry. Lubrication is not there, so it becomes drier. Epithelium appears thinner, flattening of epithelial ridges, reduction in number of filiform papilla. Langerhans cells become fewer with age, leading to a decrease in cell-mediated immunity. So allergies, infections, and inflammations are there. Decrease in cellularity occurs in lamina propria with an increase in collagen. So it becomes tight. Sebaceous fordyces spots or sebaceous glands of lips and cheeks increases with age. So these appears hanging and thick and dry. Elderly post-menopausal women have symptoms such as dryness of mouth, burning sensations, abnormal taste, and it also creates, which we will study in the third year or the second year in the oral pathology, the tumors, the cysts, and all lichen planus, pemphigoids, etc., etc. So thanks for watching. This is all about oral mucous membrane and the papillas. If you want the PPT, follow the link below. And if you have any doubts or queries about this video, please comment down below. We will try to solve it as soon as possible. Thank you so much.